Hello, I'm Michael, and I'm a volunteer with the ULHT. About 13 or so years ago, when I was at home, I used to feel a little bit bored, and I thought we need to do something different. So both my wife, who's also a volunteer within the trust, and myself made some inquiries, and in the end we found the best place to come to was this particular hospital. One of the things about being retired is you tend to lack any discipline. When you volunteer, you make yourself available on certain days, certain times. So at home, you need to get up, get yourself dressed, put this lovely yellow t-shirt on so that people know who you are, and come to the hospital. So having come to the hospital, what do I get out of it? Well, the first thing I get out of it, of course, is companionship. You've got people to talk to, you have tasks that you're given to do, and let's say you can do as many tasks as you wish. When you first start, you might be a bit nervous and do a few little jobs. Eventually, you're asked to do this and they ask you to do all sorts of things, and you become really, I call it a go-for-doofer. You go for this and you do for that. But the important thing to remember, of course, is you're here to support the staff. You are not here to replace the staff, and the staff like that. You learn new skills. I now do all sorts of things. I wasn't very good at laminating. I can laminate, photocopy, I can fax, I can do all these things which perhaps before I couldn't do. You interact with patients. Many patients come in, particularly in my ward, they're coming for surgery, they're nervous. It's the first time they've been in for surgery. They like to have a chat. Sometimes it's the first time they've had anybody to talk to for a long time, they live on their own. Others, it just takes away the sort of nervous boredom. And you find, I get told funny stories. After time, you become part of the team. You're responsible for certain things. Every time I come in, I have a certain routine. I have to prepare, fill up and clean what they call the phlebotomy trolley. It's a trolley that they move around when they come to take some of your blood and other things. I fill it up, clean it, so that the doctors are ready for them. I have to make sure that all the things that we need for stores, be it things like urinal bottles, things for the commodes, what they call PPE these days, which is masks and gloves, that they've all been collected from the appropriate place and ready for use. I also have to check that we've got the right number of what they call pods, that's things that we use internally to send, it's like an air tube thing. So these are all given to me to do. It's my job. If it's not done properly, I get told. If I do it properly, I know I've done it, and everybody's quite happy. The other thing I would like to say, I'll take my glasses off, what does the trust get out of it? Well, the trust gets some help. Help from people who will turn up, relieve the staff of some of the very routine duties, allowing them to get on and do exactly what they're supposed to do, look after the patient. When it comes to helping the staff realise that you have many years of, we call it the University of Life. When you've volunteered for a little while and you feel comfortable, you may well find that you're being asked if you'd like to sit on various committees or various organisations within the trust. There's two things about this. One is the trust gets to see you as an individual representing the public. Because you're dealing with patients who are the public, you get to hear from them various things. They like this, they don't like that, why doesn't do this. So if you get asked to join a particular group, be it health and safety, be it nutrition and hydration, you're able to talk about what the patient requires, what the patient wants, not what we as a trust think the patient wants. And sometimes this can be quite enlightening that the trust thought is totally different to what the public actually would require. So all in all, the public like talking to you, you like talking to you, and for the time you are here, you really are valued. Your mind is purely on what you're doing, and when you get back home, you go, do you know, it's really nice, so and so. And just to finalise, we do have students here, nursing students who come on an attachment. We had a student who's just finished her attachment and go back to university. She's left me a very nice card. So she really appreciated, she says on this card, the fact that I made her welcome and was able to help her out as a very young student to a very old person. No age gap, we just got on. So that's really, really nice. You're really valued by whoever you're working with. We work as a team. We're all a group of friends. Come and join us. You really will love it.